If someone had said to you in December that by April, millions of people all over the world would be infected with a mysterious new virus that has no vaccine, you'd think they were talking about a Hollywood script. It's happened so fast, it almost doesn't seem real. And it has everyone asking, when will it end? Jackson Proskow went looking for answers.
This is not normal. At least it wasn't until a few weeks ago, when everything we take for granted, everything, moved just beyond our grasp. 6 weeks ago, nobody worried about touching their own face or leaving their own house. Nobody thought about lining up to buy groceries. Now there are more planes on the ground than in the sky. Work has become a luxury for those who still have a job, especially for those who can work from home. And home is where most of us now spend our time, sitting and wondering how we get back to the world we knew.
We know that the mass social distancing measures will work. They will bring cases down. We've seen that everywhere they've been tried, and it stands to reason that if everyone stops going outside their house, that case transmission will slow considerably. The problem is you can't sustain that indefinitely.
Jeremy Konyndyk is an expert in pandemic preparedness at the Center for Global Development in Washington, D.C. He, like virtually every expert, has bad news for anyone who thinks there's an easy road back.
You need a plan B, phase 2. You have to pass the baton to a different set of protective measures so that you can keep cases low while actually having a functional economy again and allowing people to move again.
Few governments have such a plan. They're still dealing with an unfolding health disaster and a mysterious new virus. COVID-19 is stealthy and it's lethal. No one appears to have natural immunity. No one knows how widespread infections really are, or if the virus will come and go with the seasons.
The 1918 flu pandemic went on till 1920, so this could easily go on a couple of years, waxing and waning. And
Dr. Peter Hotez is a vaccine scientist at Baylor College of Medicine in Houston. He believes governments need a strategy for how daily life will operate for the next 2 years. Yes, 2 years. That's the length of time it could take to develop, test, and distribute a vaccine once the surge in cases is over.
Do you see us potentially getting to a place where restrictions on social distancing are loosened and then tightened up as localized outbreaks pop up?
Yeah, that's a possible scenario, but how do you operationalize that and how do you inform companies or universities when to stay open, when to close? And how do you get people to feel comfortable doing that, who might be terrified about resuming normal daily activity? So a lot of complexities without a lot of precedent.
The complexity is not lost on public officials anywhere. They've struggled to explain what a way out might look like.
If back to normal means acting like there never was a coronavirus problem, I don't think that's going to happen until we do have a situation where you can completely protect the population.
I think even after we're through this first wave, we will need to remain vigilant and we will need to bring in different measures. Normality, as it was before, will not come back full on until we get a vaccine for this.
In South Korea, they've learned that social distancing is only half the battle. The government implemented an aggressive system of testing, contact tracing, public alerts, and quarantine to keep case numbers and fatalities relatively low. Even then, life is nowhere close to returning to what it once was. The virus keeps popping up. Other countries have begun to relax restrictions, only to experience a second wave of infection. Canada, the U.S., and Europe are still at step 1, trying to contain the outbreak. And public health officials say they're nowhere close to being ready to think about anything else.
How are we going to get back to normal without higher levels of testing? Like, if people are walking around with this virus that don't even know it?
Right now, our focus is to tackle this actual outbreak. At some point in the near future, we will be looking at how do we apply serologic testing, for example, to look at the level of immunity in the population.
Even though everything shut down all at once, it may come back slowly, in waves, once the peak of cases is over. Perhaps restaurants and bars reopen with fewer seats inside. Schools could come next. Big concerts and sporting events are likely a long way off. Dr. Ali Muqdad worked to develop the pandemic models used by the White House.
So until we have a vaccine, our definition of normal should be totally different what normal is. So I don't expect all of us to be back to normal as 100% immediately, but in a staged approach to make sure the virus is not circulating and we don't allow this virus to have a second wave.
The risk is in coming back too fast. There's little room for trial and error when human lives are on the line. Dr. Lena Wen is the former public health commissioner for the city of Baltimore.
I don't think that you can lift it overall altogether and say, let's go back to exactly what our pre-COVID-19 days were like. That's not going to work because we know what the consequence is going to be. We're going to have a huge number of deaths and COVID-19 will spiral out of control.
Almost every expert agrees a vaccine is the fastest, safest way to get our world back, even if it means a year or more of waiting. Until that happens, we're stuck in a cat and mouse game with something that can't be seen or detected until it's too late. It may be the most painful wait of our lives.
So we're in this for a while.
We are. And it is a new normal that we all have to get used to, recognizing how difficult this is and how many sacrifices are going to be borne by everyone. But if we stop now, then these sacrifices will be in vain. And it will take much longer and many more lives will be lost.